Support comes from Thomas Nelson Community College, now becoming Virginia Peninsula Community College, the first choice to start a bachelor's degree since tuition is one-third the cost of four-year schools. More at tncc.edu.
Support comes from Hampton Roads Community Foundation, carrying out your charitable wishes forever. Whether it's helping shelter animals, feeding the homeless, enhancing the arts, or supporting students. Learn more at leaveabequest.org.
Hello, everyone. I'm Barbara Ham Lee. During the May edition of Another View on Health, we talked about health equity, and the issue of maternity care deserts in Hampton Roads struck a nerve. Many of you expressed concerns about hospitals closing maternity wards and pregnant people having to travel long distances for care, particularly in areas like Portsmouth, Southampton County, and the Northern Neck. Up next on Another View, a deeper dive into medical care for moms-to-be and why it is so critical, especially for Black women. Stay tuned. Another View is next after this regional, national, and local news from NPR and WHRO News.
Discussing today's topics from an African-American perspective, this is Another View.
Good afternoon, everyone, and welcome to Another View. I'm Barbara Ham Lee. According to the National Center for Health Statistics, 55 Black women die from childbirth per every 100,000 live births. That's 3 times the rate of white women. Healthcare disparities, including maternity care deserts, play a significant role in the lack of medical care for these women before, during, and after giving birth. So why is this so, and what do we need to do about it? Joining us for this edition of Another View on Health is Dr. Sharon Sheffield, Division President and Physician Manager at OBGYN Specialist for Women, Mid-Atlantic Women's Healthcare in Franklin. How are you, Dr. Sheffield?
I'm doing well, thank you.
Thank you so much for joining us. I'm very excited about having you on today to talk about this incredible topic. And of course, my co-host for Another View on Health, cardiologist and Director of Health Equity for Centera, Dr. Keith Newby. How are you, Dr. Newby?
I'm doing quite well, and yourself?
I'm doing fine. So first of all, I understand that we are screaming happy belated birthday now, but happy birthday to you. For yesterday was your birthday, and you turned 21 again.
For the 800th time. But that's okay. I'll take it.
And I know I have you and Dr. Sheffield joining me by phone today, but I understand that you two know each other.
Quite well. She and I were in medical school together.
Absolutely.
And it goes back further than that. So I'll let her tell you that one.
Further than medical school. Dr. Newby's sister, Cassandra, and I were college roommates. And this was well before Dr. Newby was, even, I guess, out of high school. But I know Dr. Newby before he was Dr. Newby.
Before he was Dr. Newby, absolutely.
Listen, next time you have my sister on the show, you can remind her that when she was in college, I was still in high school.
I will, and she will respond accordingly. Believe me, I love the Newby family, all of y'all. So last month, Keith, we really struck a nerve when we were talking about health equity and about what that means and what's going on. And people were really up in arms, particularly as we talked about maternity care deserts. So before we talk about exactly what happened on the show, Dr. Sheffield, I want to ask you, tell us what a maternity care desert is.
Well, a maternity care desert, I believe right now I'm living in a maternity care desert. It's basically an area where, such as a rural area like Franklin and Emporia, where there are really no providers there, in terms of, physician offices that practices obstetrics, as well as hospitals, which do not deliver babies. And, and when you say desert, it just means that a lot of these hospitals at one time were delivering babies, and, they were flourishing. The labor and deliveries were flourishing. And, for one reason or another, and I'm sure we'll get into that, those hospitals closed their labor and deliveries. And most of it is economic, So
if someone is pregnant and they find themselves in labor, if they go to an emergency room, what will happen to them? Will they be sent someplace else?
Absolutely. So these women that live in these areas that go to an emergency room that do not have labor and delivery, the hospitals by law are required to accept the patient, stabilize the patient, and then prepare the patient, once they're stable, for transfer to a facility, the closest facility that can provide the care. However, a lot of times, especially when you have women who've had babies before, the babies don't wait.
That's what I was thinking.
Some of them can deliver, in an emergency room without a labor and delivery, without a staff obstetrician, on staff.
But that's still dangerous, particularly when we're talking about the high rate of maternal deaths, particularly among Black women.
Absolutely. It's just not acceptable, and as far as I'm concerned, in a community, that, most, communities have officials who, they want the best care for their citizens. And, in a community where you, are looking for the best care, you would expect, labor and delivery and providers.
Yeah. Keith, when we were talking last month, one of the areas that came up was the closing of Maryview's birth center. You remember that?
Yes. Yeah, so one of the things that I know comes in is this exact question, because the concern is always going to be, when you have patients depending on their access to care, which is where this equity portion comes into play, whether or not those young women were, what was their prenatal care like that gets them prepared for their delivery process. Because if they don't have access or good access, like, you talk about like a desert, like in Franklin, Emporia, as Dr. Sheffield just mentioned. The question is, how are these women addressing their prenatal care so that if there are issues going on, like we talked about this, I think, I'll let you bring up this cardiomyopathy problem, but, would that even be identified as an issue going in? So if they go to like an emergency room that's really not prepared to accept those types of individual patients, what would the outcome be when they're not prepared and then the person has a cardiac event?
Yeah.
These are things that have to be taken into consideration. So if you have a place that's closed, and again, I understand economics. Trust me, I live it every day. But, bottom line is this is the business we went into. And, there has to be a level of responsibility, on all our parts, to make sure that patients get the kind of care they need.
So one, as I was saying, one of the concerns was, and we really couldn't address it last month because we did not have a representative from Bon Secours on with us. However, we did reach out to Bon Secours, and they declined to send a person to join our conversation today. However, they did send a statement, and so I'm going to read the statement, and then I'd like to get reaction from both you, Dr. Newby, and you, Dr. Sheffield. The statement from Bon Secours reads this way. The decision to close the Family Birth Center at Bon Secours Maryview Medical Center in Portsmouth was made after careful deliberation based on the needs of the community, which included an 88% decrease in deliveries, matching the national trend of declining births. When Southampton Medical Center and Rappahannock General Hospital were acquired by Bon Secours, these hospitals did not offer birthing centers. As a mission-driven healthcare organization, Bon Secours is focused on providing quality, compassionate care to all who enter our doors, and in alignment with our mission, We strive to improve the health and well-being of our communities by bringing good help to those in need, especially people who are poor, dying, and underserved. Dr. Sheffield, I know you're from Portsmouth. I'm curious to your reaction. There's one medical, and we have other medical hospitals and groups in this area, but this is one response.
Right. And yes, I am from Portsmouth. And, Dr. Newby is right. I believe that if a hospital or an institution makes a decision to shut down a labor and delivery, then they have the responsibility of making sure that the citizens have something. If it's not a birthing center, then some plan, to provide services to the community. And so Bon Secours, they did acquire Southampton and the hospital in Emporia. So all the hospitals around me now are Bon Secours. And, right now, there is no plan, for what we're going to do for the citizens. I can tell you this, that Bon Secours I have spoken with the officials at Maryview, and I am in the process of opening up a practice in Portsmouth in terms of where they're going to deliver. That remains to be determined. Right now, I deliver my babies at Centera Obice Hospital. And so, and what I do know...
So you have to go from Franklin to Suffolk, correct?
Absolutely. Let me tell you, you don't want to hear this story.
We do want to hear the story. Go.
Because, I've been here 25 years, and before they closed labor and delivery in Franklin, they closed labor and delivery in Emporia, which is about 45 minutes away. And there was one practitioner there, one obstetrician there. They closed the unit. Those patients were delivering on the side of the road and, showing up at the hospital, and we had no knowledge of what was going on. Wow. And so we got a practitioner, and we made some effort, and we were able to actually physically go there and help provide prenatal care to make the delivery safer at the hospital in Franklin. And then after that, they closed the hospital in Franklin. This is the same hospital system. It wasn't Bon Secours at the time. They closed labor and delivery in Franklin. And so the Emporia patients as well as the Franklin patients had to travel to Suffolk to Centera Obice Hospital in order to deliver. And I'll tell you, at one time, the hospital as far as South Hill, and I don't know if any of y'all know where Hill is, they closed their labor and delivery. They have since opened. I think they've been open about 3 years now. But there was nowhere to deliver your baby in this part of Western Tidewater from South Hill to Suffolk. And then some of those patients did go to Petersburg, and then high-risk patients, that's another story. We're talking about, either Norfolk or Richmond. Medical College of Virginia or EVS, MFM.
So go ahead, Dr. Newby.
Well, I was going to just say one of the things that I would be curious to know is when they talk about an 88% reduction in deliveries, I don't know. I walk out to any mall or any store I'm always seeing pregnant people walking around. So I'm trying to figure out, this 88% reduction, is it 88% reduction of people having kids or 88% reduction people decide to go to Maryview to deliver their child? Because I'm going to tell you, the only concern I have personally is that Maryview is the only hospital in Portsmouth.
Absolutely.
And everything else you're going to have to talk about going way out. Because I'm going to tell you, I've driven from Maryview to Obice. That's not a hop, skip, and a jump. That is a long way. So when you talk about the only other place that, granted, Norfolk General is only, I can drive from Norfolk General to Maryview in 7 minutes, as long as there's no traffic. But you think about it, you have to go through a tunnel, or you have to, go some roundabout way. So what happens if you got tunnel block?
Yeah, exactly.
So that's what I'm talking about in terms of responsibility. I'm not sure how that can be written off like that when you're the only hospital in something. There's no reflection on, Barnes and Core. I'm not trying to single them out. I'm just saying as relates to, medical care. I mean, you have to take that into consideration.
757-440-2665 or 1-800-940-2240 are the numbers to call to join our conversation. Are you pregnant now, and do you live in a maternity care desert? What plans have you had to make, or what kinds of hoops have you had to go through in order to get your prenatal care as well as preparing for delivery? Give us a call and tell us your story. 757-440-2665 or 1-800-940-2240. So according to a study conducted by the Maryland Population Research Center at the University of Maryland, the leading causes of Black maternal deaths are postpartum cardiomyopathy, blood pressure disorders, preeclampsia, and eclampsia. And then rounding out the top 5 for Black women is embolism, hemorrhage, and ectopic pregnancy. So all of these sound like really serious. And is the issue, and I'll start with you, Dr. Sheffield, are these issues because women aren't able to get the prenatal care and the care they need prior to getting pregnant and while they're pregnant?
Well, I'll tell you, that's a part of it.
Okay.
But the biggest part of it, and I can tell you this because I sit on the committee for maternal mortality, on the Maternal Mortality Review Committee state. And, what we do is we look at causes of death, in pregnancy. And we're looking at women who are pregnant and who have been pregnant, for a year, and that have passed away. And you're absolutely right. Prenatal care is only one part of it. There are other reasons. And this year, or last year, they've added racism as one of the causes, and it's a very interesting thing because there are a lot of reasons, and we're looking at the cardiac reasons, but there are a lot of other reasons. The community, poor housing. These are the social determinants of health. And Dr. Newby, I'm sure he knows about these things that influence, what happens to our bodies. The other thing is that, when you're pregnant, our bodies change and the physiology changes, in terms of the cardiac status, and Dr. Newby knows about that. It's just so dynamic and so interesting, and so there are a lot of factors, that kind of factor in the cause of problems and death in pregnant women who are women of color.
I saw a headline that said it is not race, it is racism that is causing these issues. When you look at the fact that when you compare what happens to African-American women versus white women, Hispanic women, and Asian, I mean, all of them, Black women are dying giving birth, when that is something that, a lot of people, even if you go back to slavery days, even though they went through horrible means in terms of delivery and so forth, but giving birth, I think, is attributed to something that is just natural and that you should not be dying from it. Dr. Newby? Yeah.
Yeah, well, I guess it goes back to this concept of when, of course, I know when people say the term racism, everybody's hair stands up on end and, backs get all bent out of shape. And, I try to tell people, I said, listen, this is really the bottom line. It's not designed to point fingers as much as to identify that there's a real issue and a real problem that has to be addressed. Racism could be subtle. It could be overt. But the bottom line is if you don't have access to things like other people have access to, somebody will say, well, that term always makes my hair stand up and the little bit I have left. If somebody says you need to pull yourself up by your bootstraps. And I'm just saying to myself, but if you have no bootstraps to pull up, right, that's going to be an issue, and again, it goes back to access. if you don't have, if even if you have access, but say you work at a place, if your ability to have an employment that allows you to have the monetary ability to pay even a copay if you go to a doctor is limited based on those social determinants of health, that's going to put you where even if you have access, you may not be able to afford that access. Mm-hmm. So it does go back to an issue of, not just the access, but how if you have the access, how do you achieve the access? What is it that you can do that puts you on the same level playing field with other people so that we all have the same ability to obtain good health? Is deeper than just, the access problem. But access problem is one of the issues that come into play. So it's multifaceted, but the thing that I hope people really hear is not so much that this is a point your finger at anybody in particular, but to identify that the problem exists and that we should be in our best Christian behavior, we should be looking to say, how do we help our fellow man or woman, and not just say, okay, we're going to shut it down because we feel like you could do better if you wanted to.
Yeah.
That's the part that we have to get around that behavior.
So, Dr. Sheffield, what do your patients tell you when they come to see you? I would imagine you have patients of all stripes, and the one thing that when we talk about the whole racism thing too is that they have found that it is irrespective of socioeconomic ability. So it's not just because you're poor and black. It is across the board. When you think about Venus Williams and the struggles that she had when she was pregnant, trying to get the doctor to pay attention. So what are your patients saying to you?
Yeah, absolutely. I'll tell you, patients and women, in general, women in general. First of all, patients seek out physicians that resemble them, and, women, and women of color and women in general. And they're looking for someone that they can trust. They're looking for someone that they can confide in and talk to, and someone who's empathetic. And that's what I get from my patients, and that's what I try to give to them. Mm-hmm. And all they want is to be listened to and respected. And, a lot of what we're talking about, we talk about what I see is what we call unconscious racism. And again, not to point the finger, but it's the system. And it's, and there are clear studies that have shown that women of color are less likely to receive proper pain medication. When they're in pain. When a patient comes in and complains of a headache, and they're pregnant, it may be just, they may just be kind of shunned. But, a headache in a pregnant woman can be a medical emergency, and it should be taken seriously, and not just a headache, take an aspirin. So, so a lot of this, what we're talking about, is unconscious. But what my patients want, they want someone to listen to them and to take their concerns seriously. And there are a lot of things that are red flags that we miss, because we don't perceive pain in certain people as real, or we don't listen because, we may be a little bit too busy. And it's not just women of color, it's women.
Women, period. Yeah. So, and they just did a study recently where even medical students today still believe that African American skin is thicker and that people don't experience pain or that we have a higher pain tolerance than other groups.
Right.
How do we turn that around, Dr. Newby?
It's just that's the question of all questions. I think really just the best way to turn things around is gain mutual respect. B, treat everyone the same. And I think that's where we have to really start to get in a different mindset. I mean, I treat, one thing, every now and then I'll get somebody that's, I won't call them famous, but I'll say they're well known. Mm-hmm. And they have typically, and some of them are very humble, but some of them have this high expectation that they should get more than what everybody else gets. I treat everybody the same. I don't care your background. I don't care your monetary status. I don't care about any of that because, I treat people like I hope the good Lord will want to treat me. Mm-hmm. I like to be treated, which is, that he's humble, that I stay humble and really stay, hopefully, that if I help somebody else, good things will come my direction. So I treat everybody the same. So I think that's always going to be the first thing is you treat everybody with mutual respect. You treat everybody as if they are your family member. Well, no, I wouldn't say that because we know everybody don't feel it. Well, I would say somebody that you like. Yes. I would say that, and I think if we start there, and I really do believe this to be true. It may sound somewhat naive, but I don't think so. I think that's where we've gotten too self-serving, and we don't really care about other people. And I say we collectively, but and I think if we can get to this idea of saying that everybody is a person and they have the right to live in an environment where they can feel free to thrive and to be healthy and to live their best life. I think that's always the first step. We get to that stage, I think we're at least starting down a path to answer that question.
Absolutely. If you're just joining us, we're talking about maternal care for African American women and overcoming the challenges of maternity care deserts with Dr. Sharon Sheffield, Division President and Physician Manager at OBGYN Specialist for Women with Mid-Atlantic Women's Care in Franklin, and cardiologist and Director of Health Equity and Centera, Dr. Keith Newby. 757-440-2665 or 1-800-940-2240. We would love to hear from you if you have recently had a child, if you are in the process of being ready to become a mom, and you are in a food desert, in a maternity care desert. We'd especially love to hear from you, but we'd also like to hear from you about the kind of care that you're getting as you wait for your newborn to be born. 757-440-2665 or 1-800-940-2240. So, doctors, according to Rachel Hardiman of the Minnesota Population Center at the University of Minnesota, and she's also the director of anti-racism research for health equity at the University of Minnesota, she says that that the healthcare system must first ask, how do systems, policies, and social structures combine to create the conditions for poor health, as opposed to asking the question that is currently asked, which is what's wrong with people of color that makes them die younger and at higher rates and suffer more illnesses. Now, she did a research study, and in her study, she found that in-hospital death rates for Black newborns was 1/3 lower when Black newborns were cared for by Black physicians rather than white physicians. How much does culture and understanding culture and one's racial identity play in terms of taking care of the mother and the child? I'll start with you, Dr. Sheffield.
Yeah, I think that's true. And not just for newborns, and I'm sure Dr. Newby will agree, but for people in general. And I think a study like that was done for Black males, if I'm not mistaken, Dr. Newby. But I think it plays a large role. And again, people, like I said, they tend to look for physicians that are like them. And so for people who, if we had more African-American doctors of color in practice, because there is a shortage, then people are more likely to get prenatal care or more likely to go to the doctor for preventative care. Otherwise, patients will wait until, it's really bad and they're feeling bad, and then they go to the emergency room and end up with someone that they're assigned to. So I think that plays a role.
A role there. Okay. Dr. Newby?
Yeah, I think, when you start looking at that piece, there's multifaceted with that as well, but I do agree. The only part that I can't tell based on it because I haven't seen the study design, but, kind of one of the things that I think Dr. Sheffield mentioned earlier was that trust factor. And that trust factor does impact on people's decision making when it relates to any medical care condition. And so in other words, if, say like an example, in my field, if I see somebody and I say that it looks like they have heart failure, and I say, okay, I really think the things that we need to do are as follows. I need you to change some aspects of your diet because we have to look at sodium restriction. I need you to start reducing your water intake, and I need you to take these medications that have been shown to improve your overall health and well-being and improve your longevity. But if I don't have your trust as a physician, then whether or not you're going to take those medicines, if you're going to adhere to that diet I gave you, if you're going to listen to that fluid restriction advice I gave, is going to be yet to be determined. So if the trust factors aren't there, you may not necessarily follow fully instructions that would involve, and this is just one set of circumstances, but that can impact in why you may see a better outcome, because if people trust their physician and their physicians are fully engaged in their care, then of course, their outcomes are going to be different, versus the opposite. And whether or not that physician engaged themselves with that patient to earn that trust, because if you're in a different cultural background, whether or not you even feel like you want to take the time to earn that patient's trust is going to be. Those are the questions at hand, which could lead to the outcome differences, in those people. But again, I didn't see the study, so I don't know the actual design. Was this just like they just polled people, or, they just looked at a certain cohort of patients and they just looked at their outcomes? But I can see the background would be that. So again, it goes back to Dr. Sheffield's point earlier about, people, they do tend to want to have physicians and providers that look like them, because that's where that trust factor comes into play.
Yeah, and that's also a part of looking at the whole idea of health equity and where are there areas that need to be changed. 757-440-2665 or 1-800-940-2240. Chris joins us from Portsmouth. Hi, Chris, you're on the air.
Hi, how are you?
I'm good.
Thank you for letting me chat. And I just wanted to thank both of your guests for the work that they do in our community. It's very necessary.
Thank you. So I understand you're a midwife?
Yes, I am. I'm a certified professional midwife in Hampton Roads.
Okay. And so do you travel all across Hampton Roads in terms of helping women to deliver?
Yes. Yes, we do.
And did you find once the major hospital in Portsmouth had closed, did your business go up?
Yes, it did. And the pandemic helped with that as well. But yes, and it's, sad. I live practically 5 minutes from Maryview, and yet I can't take any of my particular clients to that hospital for help if we need it.
So what kind of training, Chris, could you tell us briefly what kind of training you go through in order to be a midwife?
Yes. Certified professional midwives can either do a portfolio process, which includes apprenticeship, which is a minimum of 2 years, but most take 5 years. And then there's also the 3-year schooling proponent.
Okay. All right. Thank you so much for the call. We appreciate you calling in. Dr. Sheffield, what do you think? I mean, do we need to add more doulas, more midwives? How do we start to address particularly the idea of these deserts and providing some kind of assistance for women who are living in these particular rural areas and city areas that don't have hospitals?
Yeah, absolutely. One of the remedies is to include, the midwives and the doulas, to help, because there is a physician shortage, and especially a shortage in African American physicians. And so we found that, midwives have made a tremendous contribution to our profession.
Mm-hmm.
Absolutely.
So what advice do you give to a person who discovers that they're pregnant, or those who are trying to become pregnant? What do you tell them? Let's get down to some specifics about what it is that they need to be thinking about and doing in terms of their own personal health and the health of their baby.
Okay. So the most important thing, the day one when you find out you're pregnant is to seek prenatal care. One of the biggest problems is that, a lot of us, a lot of our women don't have the insurance right offhand. And, sometimes it takes a while. But, even with that, don't let it stop you because, many of us OBGYNs will go ahead and accept the patient while the paperwork is being processed with their insurance. Mm-hmm. And so, a lot of women I hear, they'll come in late for their prenatal care and you ask them why you're late. And they say, well, because I didn't have my insurance card yet, and so I guess I can't stress enough, don't wait, just call, and call and there is somebody that is going to help you get through that process if you have gotten through that process. But the most important thing is to start your prenatal care. That's the best do for yourself and your baby, and there are childbirth classes, ask questions, and I'll tell you, most women will do whatever it takes, to ensure the health of their babies. Mm-hmm. So.
And if they live in a maternity care desert, I mean, I'm thinking about how do you plan even for that travel time and because that's a factor that I think people who are close to their doctors or close to their medical facility and so forth, that's probably not something that is a critical factor, where someone who lives in a maternity care desert, that they've got to build that in.
It's really a tough thing, and that's where prenatal care comes in, because with the prenatal care, there is planning, and people that can help you with the planning, give you information about, how you can get transportation. Mm-hmm. We are limited, but I believe that some of those limitations can be offset by, just getting some prenatal care. There are certain programs now that the state has where there are nurses that will go to the homes, during the pregnancy and after the pregnancy. So there are a lot of things that can be done, to help.
And if are there certain things that women should look out for while they're pregnant that could be indicators of a problem? I mean, something that occurs frequently that maybe they're not paying attention to.
Right. So I guess the biggest thing is the preeclampsia. And preeclampsia is, high blood pressure during the pregnancy. And many of these women, they don't have a problem with high blood pressure until they get pregnant. With the preeclampsia, there are changes that occur causing increased blood pressure, and sometimes it's very difficult for a woman to know that their blood pressure is elevated. But, headache, just a simple headache can be a sign. Mm-hmm. Increased swelling, abdominal pain, anything that doesn't seem right, in the pregnancy. If your baby's not moving correctly, or if you're having, nausea, vomiting, those are signs. Even though you may chalk it off as being something else, but always don't hesitate, to call in, even after hours when you think that, the offices are closed. There should be always someone on call to answer your call about anything, really. Mm-hmm.
So, Dr. Newby, why are there fewer doctors going into obstetrics and gynecology? Do you know?
Well, I think there's several reasons.
Period,
one is you'll find that Well, just going in medicine, period, is just the grueling nature in which you do this. I mean, I tell people all the time, I went into it because I love medicine. This is not so much a career as it is a kind of a lifestyle. I think Dr. Sheffield can also attest. When you talk about 4 years of college, 4 years of medical school, I had to do 3 years of residency, 4 years of fellowship to do what I do. That's a long time. And a lot of people don't want to spend that kind of time, so you have that issue. Then you talk about the reputation at OBGYN. Everybody says, their malpractice is ridiculously high, for whatever various reasons, and so they don't want to necessarily go into fields where they feel like there's higher risk, where the actual expenses of that field are too high. I mean, it's various reasons why, but I tell you, I think the main issue is just the time it takes people, because this is a different generation. Now, this is like the immediate, I want it now, so, and the people are not going to, it doesn't work that way. But I think if you have a love for medicine, it's definitely worth it. I know for me, I couldn't see myself doing anything else than what I do. So that's just a me thing. One of the things I did want to, just before we end the show, we did talk about this cardiomyopathy issue, and I think people need to know what that is. Okay. So let me know whenever you're asking me to interject before we get.
No, go ahead. You can talk about it now.
Well, so just so people understand, when they hear the term postpartum cardiomyopathy, that means that the heart becomes affected as a result of some issue, and we still don't always know. We think it's, for the most part, autoimmune response, where the heart gets attacked by the body's own antibodies, and it creates this issue where the heart muscle gets inflamed and then it gets weak. And that typically can happen almost at delivery or a little bit before delivery, up to like 5 or 6 months after they deliver. And one of the big things people will see is, which is why people don't always recognize it, is fluid retention, which a lot of women have that anyway. But if you're getting short of breath, which a lot of pregnant women will have, you may not necessarily identify that that's going on. Now, that's not like a common problem, but you do see it, and I see it enough that you want to make sure people recognize, and that's where that pre-postnatal care is so important, because you can identify, like an example, if you have hypertension before pregnancy, you're going to have hypertension during pregnancy. I mean, it's not going to go away. But the thing is, unfortunately, because a lot of people are, they kind of have this mindset where, because I feel fine, even though I have hypertension, I feel good, therefore I don't have to worry about it. And that's where we're trying to get people out of that mindset. Let the professionals help you, guide you, so that you go through this process safely. I mean, people, doctors like Dr. Sheffield, she's going to be your first point of contact, because you probably won't have me, because I'm a cardiologist. You wouldn't necessarily need me prior to, but they can help identify a problem early enough so that if there is an issue, exactly, and it could get addressed before it becomes an issue. Hence, some of that issue you were talking about with what happens, what are the big causes of maternal death, after delivery. And if you don't recognize that the problem is there, it's going to be hard for you to know. And depending on where you're delivering this child, they don't know who you are, because a lot of times there's no care ahead of time. So, you're kind of like, you deliver and everything seems fine, but then you have a complication after that for something that probably could have been caught had you just had access in the care you needed ahead of time.
Dr. Sheffield, is that relationship, that OBGYN patient relationship, it sounds like it's even more intimate than maybe some of your other interactions with other doctors, because you really have to get to know that person, don't you?
Absolutely. We really know our patients, and for a lot of patients, especially in rural areas like I live in, we are the primary care providers. And so, we deliver the children. We take care of the patients even after, they've delivered their babies with the GYN, and then some of the primary care, some of the high blood pressure issues. Absolutely.
So, and I want to ask you the same question, since you're in the specialty. Why do you think that there are so few doctors going into your specialty these days?
Well, I think Dr. Newby was correct in what he said about the malpractice and the amount of training, but also our life, the lifestyle of an OBGYN. You know, we take call, you know, and we're up in the middle of the night. We're delivering these babies, you know, and, you know, historically we have, you know, covered our offices during the day, you know, laboring patients in the hospital all at the same time and laboring patients in the middle of the night. It's gotten a little bit better in that now we have OB, what we call OB hospitalists, that do nothing but stay in the hospital and take care of the babies while, you know, the clinical doctors, you know, see patients in the office. So we're making it's becoming a better lifestyle, but I believe the lifestyle, you know, of an OB is, you know, it's tough. And like Dr. Newby said, you gotta love it. You really have got to be committed and love it, you know. And many of us who are in the field, we do, and you know, and we do a good job at it.
So I'm curious. As long as you've been in the field, is the miracle of birth still a miracle to you?
It is a miracle. Every day I see something new. You know, it is a gift and a miracle. I'll tell you.
So before I let you go, Lisa was telling me, our producer, when she was speaking with you, that you're getting ready to open a new practice, or you had to move or add a practice so that you could help accommodate more of the women in the Southampton area.
Well, yes, that was our plan. Our plan was to actually have an office in Portsmouth, and there is a space in Portsmouth. Unfortunately, we had a passing away of a colleague, you know, who was my partner working with me, and so that kind of stopped it, you know, for right now. It's sort of on hold, but yeah, the plan, really the true plan, is to accommodate women, you know, in this area of Tidewater, the Western Tidewater, and Portsmouth.
Okay.
And so that's our plan.
All right. That's Dr. Sharon Sheffield. She's Division President and Physician Manager at OBGYN Specialist for Women, Mid-Atlantic Women's Care in Franklin. Thank you so much for joining us. We really appreciate it. And Dr. Newby, you get the last 30 seconds.
Well, thank you. I appreciate that. Well, I would say this. I tell this to all the patients. I don't care where you are. Do not hesitate. You know, get to see that physician, whoever, whatever the scenario is. Be guided by them. Find somebody that you do trust, and you know, listen. Whatever time it takes to find that person, find them. You know, they will help guide you down this path so that you can live your best life and stay as healthy as possible. And we want to see you thrive and do well. So please, if you hear nothing else I say, get that physician and go see them and just listen to what they have to say. And please stay healthy and safe out here. And get your vaccine.
Absolutely. Get that vaccine. That's cardiologist and Director of Health Equity at Centera, Dr. Keith Newby. Thanks so much, and we'll be right back.
Hi, my name is Renee Elise Goldsberry, and you're listening to Another View. Daddy said not to go downtown. Like I said, you're free to go, but look around, the revolution's happening.
And welcome back. It's Broadcast Award season, so we thought it'd be the perfect time to bring you an encore of our most awarded selected short of 2021. It's the story of Freeman Vines and the Hanging Tree Guitars. The video version of the piece has already won a Telly Award and is nominated for a Virginia Association of Broadcasters Award and a Regional Emmy. It's just one of those stories that once you hear it, you won't soon forget. But there's another reason to share it once more. The Hanging Tree Guitars are currently on display at the Portsmouth Art and Cultural Center. You can see for yourself up close what producer Lisa Godley is about to describe.
Well, I bought some wood from a white fella, and as I was loading on my truck, he told me, he said, that wood there where you bought, he said a man would have hung on that tree. I didn't believe it.
Southern trees bear strange
orange fruit.
78-year-old Freeman Vines would continue his disbelief about the wood until he shared his story with his friend Tim Duffy, who decided to do a little digging and uncovered the bone-chilling truth.
Next thing I know, he had newspaper clippings, and he had done infiltrated the folks and found out that it was true about the wood. A man was killed on that wood there. Shot him 200 times and cut off stuff and stuck in his mouth, and it was horrific the way he died.
Vines says he learned that the horrifying lynching happened in 1930, not far from his current home. And the more Tim researched and wanted to explore the area, the more uneasy Vines felt.
He had the name of the road. He tried to carry me on the road we were killed on, tried to tell me about the folks. I said, Tim, I don't want to hear no more now. I said, "Cause I got to live down here." See, them people still down here right on, and they're a little bit old, but they got relatives and stuff that ain't old, so I didn't want to get too deep in that.
But concerns about his neighbors and his own safety was only the beginning. Vines, who has been making guitars for 50 years, experienced something he'd never felt before.
There was something strange about that wood, real strange. It had features in there that all you had to do was embellish them with a John Brown wire brush, and here would come stuff that would scare you to death, especially if you work nights like I do. Most had features like skulls and terror on faces and stuff. Snakes coming out of skull's mouth and eyes and all like that right there. All I had to do was scrape a little bit to get the bad wood from the good wood, and when I get through scraping, I said, "Good God Almighty, let me leave this alone." I ain't never had my hands on some wood that had experienced and seen and heard what that wood had. I went on and finished some of them anyway.
Vines says he's not certain how many of the guitars he made, but does remember how glad he was when Tim came to take them away for the museum tour. But the story doesn't end there.
Tim came up. There was a piece there that I wasn't going to bother with. Had a bad knot on it. So he kept right on and on and on. What he gonna do with this and that and everything? So when he left, I got my mallet and started beating the knot. And when the knot came out and I shot one piece on top of the other, it was a shoe. Man, did that get to me. A pure natural shoe. So all I did, glued the top with the bottom, sanded it off a little bit, and the more I sanded and messed with it, the more it became the shape of an old shoe. Now, here's the little history behind that. Tim told me that the man that they killed worked on shoes because the folks were so poor they couldn't buy no shoes, so he would nail a little stuff over the holes and stuff. I didn't know that.
Freeman Vines believes that all of the wood he works with carries a story. For 5 decades, he's built guitars out of materials that encompass his past: tobacco barns, mule troughs, and radio parts, to name a few. But nothing compares to the story of the wood from the hanging tree. Vines' hanging tree guitars hold a history that is seldom told, one that embodies the horrible acts of racism committed in the Jim Crow South, a story brought straight out of the wood into the world. For Another View, I'm Lisa Godley.
And Freeman Vines' hanging tree guitars are on display at the Portsmouth Art and Cultural Center now through August 1st. And we'll be keeping our fingers crossed for Lisa and her team during this weekend's award ceremonies. Bring home the gold, you guys. We're looking forward to that. And that's it for today's edition of Another View. Please share this show with others you know. Go to anotherviewradio.org and download the podcast. And please sign up for our eView newsletter. It's a once-a-week reminder of upcoming shows. My birthday is next week, and I'm going to take some time off to relax. But you're in excellent hands where producer Lisa Godley will be sitting in the host chair. Our theme music is an original composition created especially for Another View by Jay Sennett. Lisa Godley is our show producer. Todd Washburn is our audio engineer, and Dr. Barry Graham answered our phones. Here's wishing you an early happy 4th of July, and I'll be with you in 2 weeks when Another View starts its 12th year on the radio. Thank you so much for listening to Another View.
Support comes from Thomas Nelson Community College, now becoming Virginia Peninsula Community College, the first choice, whether starting your bachelor's degree or advancing your career. More at tncc.edu.
Support comes from Hampton Roads Community Foundation, partnering with donors from all walks of life to improve southeastern Virginia through grants, scholarships, and leadership initiatives. Learn more at hamptonroadscf.org.